This is the anastomotic model. So prostate's out. Now we're going to bring things back together again. And I have one of our chief residents here. This is Dr. Amar Rabal. So Amar this is his 6th year of residency. And this is something that I would be teaching him in the operating room, right? This actual part of the operation. But again, the nice thing about simulation is that he can come, look at this, get used to it before he actually goes into the operating room. So practicing on a simulator versus practicing on patient. And again, one thing that I was sold on when I saw this software the first time was the realism, how the tissue behaves, the anatomy, even the suture. So this suture that they're showing you is a barbed suture. This is what we use in the operating room. And it's a suture that has small barbs on it. All the barbs go in the same direction. And what that does is it gives you constant back tension. And I think it makes the anastomosis a little bit more tight. So not only basic tissue identification, but also how to handle a needle in tissue. And I think that that's where this is extremely valuable, because if you watch Hummer actually do this portion of the operation, he's following the needle all the way through the tissue. And that is something that we try to teach our trainees when they throw sutures. One thing that you can't appreciate until you've been in there is just how delicate this tissue is. The urethra, which is this structure right here, is a very, very thin tissued, very delicate area. So if you apply too much tension or too much traction, you're going to rip through that. And the simulator will tell you that. If you're applying too much pressure, the actual instruments will turn red in those situations. So again, it's not just teaching you anatomy, it's also teaching you how to tell by visual cues how much pressure to apply to what parts of the tissue in order to do the operation without excessive trauma to the actual patient to the tissue. This is guided. So he's following the yellow dots, which turn green when he's put the needle where it's supposed to go. And if he doesn't put the needle where it's supposed to go, it actually turns red. Once Amar becomes familiar with this portion of the simulation, he can go a step further and go to the freehand anastomosis, where he does it, but he's not being prompted on where to throw the needle. And this is how we do it in the operating room. We use a barbed suture. We use this type of needle, and we bring it together step by step in a running fashion. So we're not doing anything here that we're not used to doing in the operating room, which makes the simulator even that much more applicable. Amar's throwing a lot of these with his left hand and with his right hand, and this is what we expect in the operating room. You know, the male pelvis is very, very tight. There's not a lot of room to actually maneuver in there, so he's having to switch from left hand to right hand multiple times in order to get that exact angle that he needs to get to throw the suture in that specific area. And again, that's a huge advantage of the simulation.